To this now. 34,000 new HIV infections have been reported in Ghana since the beginning of the year. This is despite ongoing efforts to lower infection rates and achieve the United Nations HIV/AIDS 90-90-90 targets. Joining me on this is a Ghanaian doctor, Dr. Hannah Lisa Tetteh, who joins us now. Dr. Hannah, thank you so much for the time. Really appreciate it. 34,000 already. This pandemic, this epidemic, as we'd like to look at it as well, was one that had enraged itself across Africa, across the world, really. And we thought perhaps there had been a hold on it. But a lot more cases coming to the fore. Do we know why?
So thank you for having me. I think that we have relaxed, should I say, in terms of education, in terms of awareness. I mean, we know the disease is there, but do we care as much as we used to care about it? Is it that we don't scare people anymore? You know, initially we started with the scare people approach in advocacy, but it looks like now we're telling people, take your medications, you'll be fine. So people are not scared. So is the message being perceived differently such that now people are not scared anymore? So, okay, I can get HIV and AIDS and I can just go about my normal life. So there's no reason to be scared about it. Is it that because we don't talk about it as much, because we don't want people to be scared and we don't want people to be stigmatized in society, people have become relaxed towards adherence to their medications and the drugs? So these are the questions that are being raised. Is it the message that is being perceived differently, or people are just relaxed about it because, well, it's business as usual?
Yeah, and obviously it does happen in the key population areas as well. The question mark becomes then, is it going to be the responsibility of government perhaps to put an end to this somehow, with communication further happening, with more communications around this as well being put forward as well by the government? Should we be going back to some of those scare tactics even?
Yes, I think we need to go back to the drawing board. I mean, the message was well perceived. Everybody was scared. People were taking their medications, and then people didn't want to die. But the more the medications became effective, prolonged the lives of people, people could have HIV for a very long time before it progressed to AIDS. We've seen people whose viral load has reduced drastically such that they can't even transmit it to the next people. People have become so relaxed. So I think we need to go back to the drawing board. It's not just the government or non-governmental agencies. It's all of us. What message are we giving? How is it being perceived? Do we need to change the message, the communication, the forms of advocacy? Yes, we need to go back because the numbers are increasing. We're giving medications, the numbers are increasing, but it's still would make it difficult to hit the target of no HIV or AIDS if we are to go this way.
Are there sufficient, is there enough sort of antiretroviral treatment and other treatment and the like as well? Is that readily available, or is there perhaps a shortage of that which is also creating this epidemic as we're knowing it now and this increased number of cases?
Yes, and that's an important point you raised in your question. It's the antiretrovirals are available, but they're not as accessible to everyone as they should be. There are certain people who also don't come for their medicines even when they are available. So yes, that's where the government comes in. That's when donor agencies come in, and that's where funding is very necessary. The medicine should be available to everybody. They should be available for long periods. Then people living with HIV also have the responsibility of coming for the medications. Now, do we create the right environment so that people can come for their medications? Are they scared? Are they stigmatized? In most hospitals, there are particular places. So you see everybody walking there, and then we know that they have HIV and AIDS. Because of that, people don't want to come for their medication. And so it's an all-pronged approach. All of us need to come together to work to ensure that we reduce the numbers.
Yeah, and I mean, that stigma is something to really look at as well, as to, how much consumers are, or how much people are sort of looking at the stigma being a key reasoning for why they perhaps then don't go for their medication. Are we able to clear out some of that stigma? Has that stigma still stuck, or has messaging perhaps still prevailed in such a way that it still feels like a curse ultimately when you have something like HIV and AIDS?
So yes, I mean, there have been efforts. It's not as stigmatized as it used to be, but still a lot more can be done. Now, a very important issue is the fact that the individuals themselves sometimes stigmatize against themselves because they are used to stigmatizing others who have it. When they get it, they just assume that everybody would stigmatize against them. And practical examples would be people coming to the clinic, you tell them, you may have a sexually transmitted infection. They would opt for any and every test except HIV and AIDS. And you ask them why. They say it is too life-changing. Now, the issue is whether or not it's life-changing. The other ones are life-changing as well. So why is it that with HIV and AIDS, you don't want to do the test? And the issue also about spread most of the time happens within married couples too. They don't want to tell their partners because they feel their partners and their loved ones will stigmatize against them or will leave them, as they say. It extends to family and friends because it can be transmitted through blood. People are scared to even tell their families and their friends. So it's not just the public or society stigmatizing, but it's close friends and relations stigmatizing, and the people thinking they will be stigmatized again. So it's a very, very big issue. I think that publicly, a lot is being done to reduce stigmatization. But when it comes to the nuclear family, the people, his or her friends, his or her family, then I think that not much is being done there.
Yeah, I mean, I was actually going to ask about the testing, whether that's been on the increase or whether that's actually decreased now, because people have assumed that they won't catch it as much, that they can't be doing it because they're going to get a lot of that test, the stigma as well. Are you seeing less people testing overall? Is that what you're saying as well?
So when we are testing in the public space, when we're making it free, you see people coming to test. And you see people who believe they don't have it coming to test. So mostly people who are not sexually active, or the very young people, or senior high school students, 18, 17. People who come for testing are people who are more or less confident that they don't have it because they're not sexually active. But when we go higher to those who are sexually active, we have more females coming to test. Because I don't know, some females think that they're not as promiscuous, but you find the men being scared to test and then being scared of what the outcome may be. They think it's too life-changing. I think another challenge that maybe the health facilities and the health institutions can take responsibility for is the pre-testing counseling. Sometimes it's not done very well. And so people just get up and they're going to go and test, and then when it turns out that they are positive, they feel their life is over. But if it's done very well, it's being implemented in most institutions. But if it's done very well, people are not scared to test and they're not scared of the outcome. So it depends on what we're looking at, the age group, where the testing is being done, and whether or not it's free.
Dr. Hannah-Lisa Tetteh, thank you so much for the time. Really appreciate it. I think it's a very prevalent and important situation and issue as well that is still prevalent across Africa as well, not just in Ghana, even though we are reporting, of course, of a 34,000 increase in the number of cases. Thank you so much for the time. Medical doctor out of Ghana.